Parallel parking,
It is
sure
parallel,
it
and you
is.
make sure your brakes are on. All right. And then put the gate belt on.
And they ordered a bunch of gate belts with plastic
Uh-huh.
buckles on them. And they told me, so this was Dr. At Northwest College, her name's escaping me right now. She said, no, we only use metal buckles at Northwest and at the hospital. Well, I said, I think because the plastic ones could maybe break.
Okay.
So she said they only train with metal, so I'd order metal.
So you always explain to the patient what you're gonna do. Okay, so I'm gonna help you get back into bed. I'm gonna get my knee in between here and put my hands here. You're gonna put your arms around me, my back. And then when I count to 3, you're gonna lean forward and I'm gonna help you up, okay? And do you understand those instructions? Make sure they know, okay? On the count of 3, you're gonna stand up. Use your feet to push. 1, 2, 3, stand up. There you go. Okay, so now you got them in a standing position. Somebody needs to undo the wheelchair.
So I take it away?
Yep. Remove the wheelchair.
So you need 2 people then?
Yeah. Or if they're steady enough, you could put like a walker in front of them and tell them to hold the walker, and then you walk behind them, pull it, and come back. And if you have to do it by yourself,
Gotcha.
and it's someone that's able to transfer with just one person. Okay, so you're gonna step to the side, get closer to the bed. Now you're gonna turn towards me, back up until you feel the bed behind your legs, and then you're gonna sit down.
This sounds super weird, but people will
You're doing a good
cross
job.
their feet. So to
Yeah.
actually get them to step around and not like twist their feet around is harder than it sounds too.
And that's another thing we do in report, when we report off to each other, is we tell the oncoming nurse, it's a 1-person assist, this patient is a 1-person assist, a 2-person assist. This patient used the Hoyer lip, like, it's like a maximum person assist. So that, you tell them that, you let them know they have a steady gait. Do you know what that is?
Walk.
They have a steady gait and they can bear their own weight. They're a 1-person assist, okay? Or they are bed and chair only. They cannot walk unless they have a 2-person assist. Like, so you give them you always go over like the
So it's
safety.
the nurse coming off that's giving that report to the nurses
The
coming on.
oncoming nurse, and then it just keeps going, like whatever happens throughout the day. Like, say the person was a 2-person assist when you started, but then they got stronger, they worked with physical therapy, they really improved, they they were connected to machines, now they're not connected to machines anymore, they can move more freely, now they're a 1-person assist. So you just keep updating it as you go forward.
And those are those in a computer, or do you write those down?
We give verbal report.
Verbal report.
And when I was, my last job at Mayo Clinic, we did bedside report. And I really liked it because
So you were both there?
we're at the patient's bed with the patient,
Oh, yeah,
and
that's
we
good.
report off to each other in front of the patient. So it helps when you give a report, because like I would look at the patient's head and I'd start with the head, like they're alert, they're oriented, then I would like think of brain. I just work my way down the body systems. Like brain, their pupils are equal, reactive, they can eat without assistance. Then chest and lungs, or heart and lungs. They have normal sinus rhythm and clear lung sounds. Then you go to stomach. They've got good bowel sounds. They last went to the bathroom on this date. And then you just keep going. Their circulatory system, they've got good pulses. There's radial pulses, femoral pulses, dorsal, DP pulses, tibial pulses. They're all normal, if they were normal. If they weren't, then you also want to tell them about skin. I noticed they have like the beginning stages of a bed sore, stage 1. You just go through the whole body system. And then when you have, I'll go back to this, when you have somebody sitting on the bed like this, then you're gonna lower them down on their side. So you're gonna tell them, I'm gonna help you lay down on your side with your head on the pillow here. And while you're laying down on your side, I'm gonna help you get your legs up. You want them laying on their side, like before. So here we go, you ready? All right, now put 2 hands under here and we go down. And she can luckily assist me. So now she's in bed. And then she's a little bit too close this side. So this is when we would use the sheet to like move her over. You wanna go on that side and I'll show you?
Sure.
So I pulled this part out and then just kind of roll it up until you get it as close to her body as you can. But you always wanna be as close to what you're lifting. And then, I should have told you this too, we raise the bed up so you're not bending over like that. You can be a little higher. You want it to be like level with, and it's gonna be hard because I'm shorter than you. Does she have one right?
There's one around here.
Here we go. And open your hands. Because they will, if you hurt yourself in the hospital, and you have to do like an incident report, and you do something big, they're gonna ask you, did you use the gate belt? Did you use what was available to help you? Did you have another person? Did you try? So we get it rolled up close to her, okay?
So you have to prove it's not your fault, basically, that
Yeah.
you got hurt.
Mhm. So this, we'll count to 3 and we'll lift her like kind of up and over to the center of the bed, okay? So on the count of 3, we're gonna lift you up and put you in the center of the bed, okay?
Okay.
And you're doing great with your arms crossed across your chest like that. Okay, ready? 1, 2, 3. Up and over. And then she's still a little crooked, so we just straighten her out like that. And then, like say you want her head to be a little higher. On the count of 3, we're gonna bend with our legs and then just pull up a little bit. Okay, 1, 2, 3, but not too much because you'll bang her head on that.
Right.
So now we got her where we want her. And then we're gonna lift your head up, I think.
Now you're all nice and
And
comfy
then you
now.
see how you got measurements under your bed? Because there's different bed positions too. Like the doctor will say, when in bed, they want them at 45 degrees.
Oh, that's why those are
So
there.
you want to
Okay.
get your head elevation to 45 degrees, and I probably should have put the bed rails up. But
Oh, and
I was a good teacher.
so the doctor tells them where to.
Yeah, they
those
want
are the-
them head of beds 45 degrees at all times, because this is probably like most optimal for their lung capacity and
So when people go in and move the beds around,
yeah.
that could be.
Or they'll say you can have their head at 15 degrees.
So how are you reading that?
See, there's an arrow.
Oh, right there.
And you line
Can
it
you
up.
guys see that? You see what she's talking about? There's a little arrow thing on there, and so when you do the bed, that's where you set it.
That's
to
how
the
many degrees the head of the bed is elevated.
So how about the foot?
And it doesn't have one for the
It doesn't
bed.
have one for the feet?
Yeah, and it's mainly for like with the feet. Let's see if there is one for the feet. They do have, you can elevate the feet, but I don't know if this bed has it.
It does.
Okay, yeah, then you do that. But you can't measure
But
it.
you can't measure. Oh, wait, what's this? Trend angle, wait. right
That's the
here.
Trendelenburg. When you put them in Trendelenburg, it'll tell you what
Oh.
degree.
See, tell us what that is again. You guys
Trendelenburg.
remember she said it before. Trend.
Head, knee, other side rail lockouts. I don't know why this one. Maybe, do we have the knee locked on there?
Yep.
Yep.
Okay. And so then, like if they have a lot of swelling in their legs, like a congestive heart failure patient has like a lot of swelling, you want to elevate those legs. So now she's crunched.
And you can just keep right on elevating.
Yep. And then sometimes we even have to put pillows up there because you want to get that fluid off of those legs. And then it's hard for people that have compromised lungs to lay flat or to have their head 15 because if they have fluid in their lungs, it just kind of pools there. So if you sit them up, it's a lot better. They can breathe easier, they get better oxygenation.
Even like things like heartburn, some of that
Yeah,
kind of stuff,
yeah.
like acid
Mhm.
reflux and
So
stuff.
that's why the doctor will say head of bed 45 degrees at all time while in bed.
Yeah.
I think what else?
Braille stuff.
Yeah. Now we'll get you out of bed and get you back to the chair. I think you're being a good
You're
patient.
such a good girl. You haven't even yelled.
I mean, there's so many things. They just, like, when you work in the hospital, they just drill it into you and it becomes like, you don't even think about it. Like, you always check your patient's name band before you ever, like, and it's also a good way to check to see their mental status. You know, if you want to ask them, do you know where you are, who you are, what year it is? You want to make sure that they are oriented to time, place, date, situation. So I come in and say, good morning, can you tell me your name?
That's why they
What
do
is
that.
your
Okay.
name? What's your date of birth? Okay, I got the right person. And they know who they are. And so that's one, I don't have to go over that when I do the neuro assessment. I already know they know who they are, so then I'll just ask, do you know what day it is? And
And they
if
do
don't
that
know the
every time they
day,
change
do you know what year it
shifts.
is?
Oh, yeah,
Do you
okay.
know where you are? If they don't know the year, you can, just to see if they understand what time period is, you can say, do you know who the president is? And if they say like Ronald Reagan, then you're like, okay. And then, or they'll give you some answer. Do you know where you are? And they're like, I'm at the beauty salon or whatever, you know. Then you know this person.
And could that be medications? Could that
It
be?
can be. It's called altered mental status.
Okay.
And it could be medication related. It could be they have dementia. It could be they have Alzheimer's. Because a lot of old people, they'll just say yes to everything you say, and you think they understand what you're asking them. Because yes, How are you today? Good. They'll just give you the one words. But when you ask the question, like, do you know what year it is? And they're like, 1972. And then you go, okay, let me ask them, do you know where you are? And then they give you another wrong answer, then you know. And if nobody else has alerted anybody about it, then you need to call the doctor and tell them, like, this patient knew where they were last shift. This shift, they don't know where they are. They could have had a stroke. There could be a lot of things going on, so they need to pay attention to that.
Just as simple as questioning, asking questions that take thinking type of answers. That's why they
And
do
you
that.
want to make sure that they're going to be able to follow directions too. Like, make sure you use your call light before you try to get out of bed. But if you haven't assessed their mental status and they don't really, they're not going to follow that direction. So then when they answer all the questions wrong, you need to make sure your bed alarms are on. Well, you need to make sure everybody has their bed alarm on, because even someone that is coherent won't follow directions. But you really want to take extra safety precautions with the people that you know have altered mental status.
It's interesting. That's why we stayed with my mom, because they
Yeah.
didn't have bed alarms,
Yeah,
and I knew that she was gonna
yeah. You try to get a
go
sitter,
goofy and
somebody.
get up. Yep.
I would try to like chart in their rooms so I could see them.
Oh, that's cool. You did?
Mm-hmm.
I hardly
Try to
ever
stay in
saw
their room
that.
as much as possible. The ones that were really confused, I would just. Well, we had computers in the room that I could chart on all my patients with.
Oh, that's cool.
So I would just sit in there and just do my charting. And then there's nursing assistants you can get to help you, but they're really spread thin. But you just want to make sure you have eyes on the patient if they're really that confused. And if you can't do it, you've got to ask someone to get you a sitter or see if a family member can be there with the patient. So getting out of bed is the same thing in reverse that we did to get in the bed. So we want to make the bed flat, and you're going to, we're going to keep it like that because we've got to be level. All right, so patient, I'm going to be putting your head down and putting your feet down. Let me know if you feel okay. And help get out of bed.
We actually picked a good patient. How are you feeling today?
I'm the same.
You're the same, your head is still hurting? Ah,
That was like the last resort before doing a CAT scan.
oh, goodness.
Alrighty, so now we're gonna ask her to, well, let's lift it up because we don't want to hurt our backs. I'm gonna lift it up more towards her waist level. Thank goodness these beds.
So you lift that to your,
Yeah, so
thighs?
you're not bending over, but now we have a discrepancy, so we're gonna have to meet in the middle
oh,
here.
that was our bell.
Oh, you're done? Okay. Darn. Okay, so you
No,
bend
wait,
your
let's
knee.
get her out
We'll help her get out. You bend your knee like this, all right? And then I am going to help you roll over onto your side. So I'll hold her shoulder and I'll hold her knee and I'll
As a
roll her
unit.
over to the side. You can put the side rail up
You don't pull her out.
so she doesn't fall out. Hold on to the side rail. Okay, now I'm gonna lower you down so you can sit up. All right, I'm gonna have to-
So taking shortcuts is where people
Yeah.
hurt themselves.
Yeah, you don't make it. Okay, so now I'm gonna put this rail down. I'm gonna put one hand underneath her shoulder here. Well, you can push up with this too. See, you can tell I'm ICU and I'm not used to people being able to do anything. I'm sorry.
And I
You can push, okay, so we're gonna get your legs to the edge here. All right, you're gonna push up with your hand and I'll help you with your shoulder and the gate belt.
on the gate belt. So you
And
put the
just
gate
push her
belt
up,
on
like
before
that.
you even sit them up.
There you go.
And then you transfer them to the chair.
Yeah.
Hey, we can practice that. So
Okay.
if you guys want to practice that.
You guys can
It
use the
sounds-
wheelchair. I'm not-
Can we? Okay, it sounds so simple, but
I know.
this is huge stuff.